which we don't have time to talk about, but as pulse slide, the same EAG source can be connected to a laser lipolysis system, and this arm can deliver different wavelengths from 1064 through 1320 and 2940, which is what I'm going to demonstrate to you. What I wanted to show you, if it's possible to zoom in on the screen, just to give you a few minutes for the settings. This is, in live demos you cannot really work the same way you work at home. So I've chosen, since I cannot follow up the patient, I've chosen parameters that are quite conservative. But what I want to show you are two different things. First, you have a good correlation in the software between ablation depth, coagulation, and the density or coverage or treatment area. Now, this is obviously not exact. It can never be exact because the absorption of the skin changes from place to place, from patient to patient, and even in the same phase, the same patient, different days, different hydration, and the absorption is going to be different. But what is important is that, as I've said, you have a good correlation here with your depth of ablation, and you can change also how much coagulation you want. So coagulation is important both for skin tightening to deliver deep heat with relatively shallow ablation, and yet, can you focus on that, please? No, focus. Focus. Okay, thank you. If it can be a bit neater. And so this coagulation here, I don't know if you can see it. It looks blurred on my end. Anyway, this is a feature that you don't often see in erbium YAG lasers, and it's more conceived to be typical of CO2 lasers, and this is very important.
It's impossible to get focus so near.
Yeah, that's what I asked for, but my Portuguese is not good enough this morning, thanks to the excellent wine I had here last night. So, just joking, I'm sober, don't worry. And so I was telling you, it's difficult to see erbium YAG laser with such coagulative power, and this is very meaningful because of two reasons. First, this laser is really powerful. Second, it has actually two lasers in one. One ablates, the other one coagulates. So you have the possibility of customizing the treatment that you want to give in different areas of the same face. This is what you're going to see here. We have a can you focus on the patient now, please? We have a 17-year-old with active acne scarring. That means you have evolving erythematous scars here. If you can zoom back in, please, I would be grateful so my colleagues in the audience can see the kind of problem. Now, when the patient is lying down, all scars are flattened, but these scars are quite deep. And you can see that on this other side, we also have quite deep scars. Of course, in one treatment, it's impossible to make these scars disappear. We have some areas that will react better thanks to the presence of hair follicles, a good regenerative potential is there. Probably in the upper areas, there are also enough sebaceous glands, but the regeneration is going to be less adequate. Now, so this is why I've already warned the patient that regardless of the intensity of the treatment that we're going to perform today, he's probably going to need further treatments in the future. My personal opinion is that you should wait at least 1 year to see the result of good collagen remodeling before proposing further treatments. I'm wearing my safety goggles, which we couldn't find ours. Probably someone fell in love with them, so I have to publicly thank Photona for lending me their erbium YAG protective goggles. And so basically, we're going to start now. What I want to underline here is that this patient has no anesthesia of any kind. I don't have time to tell you all the reasons why I'm doing this, but definitely for as far as safety is concerned, this is a very good way to ensure that you're not going to aggravate the condition of the patient, first. And second, it's a very good way to to avoid that overhydration by a topical cream will change the absorption of the skin. So here we go now. I'm going to treat this area, which is the deepest scar. You see that the patient jumped because the noise is quite scaring, but after that, he's quite comfortable with the treatment. Again, he had no pre-medication, no local anesthesia, no injections, no sedations, nothing. Okay? As you can see, I warned him if the treatment is not tolerable, he should tell me immediately. Now, even though the coagulation here is quite good, in where the fresh lesions are, it's still possible to see some very small bleeding, but then you have that with no matter which laser. So as you can see, I'm not keeping my hand still because I don't want to hide this from the camera, but as you can see, the treatment is not only tunable, but also perfectly tolerable. The power of the machine lets you treat large areas quite fast. If I can have a gauze, please. A gauze. So basically, you can obviously tune. This is a relatively deeper treatment in the scarred areas, but then I'm going to feather with a micropeel the rest of the face so that we don't have the tide marks. Thank you. And as you can see, we have some bleeding here as expected in the fresh lesions, which I have no problem in treating, but in the rest of the face where you have no lesions, the coagulation power of the laser is quite good. Are there any questions from the audience?
No questions.
Can you hear me at all?
Yes. Are you listening to me? No?
Okay, one question here from the room, if you can hear me, is would it be better to do subcision of these scars? That's definitely one way to deal with them. However, subcision of a fresh evolving lesion, I don't know how safe that is. On the contrary, I prefer to do two other things. One, which are more regenerative and less mutilating. One way to promote regeneration is to, on these evolving lesions, is to treat them like evolving scars. Use visible wavelengths, whether you have a yellow or a green wavelength or a good pulse, a good pulse like this using a low filter. You can definitely, biomodulation, help and improve the condition of that area. Now, what I'm going to do is I will do a second passage here where the biggest scars are, and I've measured the distance between these two lesions before the treatment, and that was exactly 2 centimeters. And I'm going to show you the kind of contraction that you can immediately get. And again, this is quite a mild treatment. This is thanks to the coagulative properties of this. So you can see that at least 1 millimeter, even with this soft, I don't know if you can see it.
We can see.
But it's already slightly less than 20 millimeters. I don't know if it's evident. From here, it's quite visible. And so this is because here the skin should not be mutilated. I think it should be, we should promote more regeneration and look for tightening by means of improving skin quality and not just by aggression and removing columns of skin. Unlike what other fractional systems do, that they have a very small spot, they drill holes, I think that here we should, again, sorry for repeating myself, but that's my main message. We should promote regeneration, and the little holes that we can do, if we have a good coagulative power behind them, can transmit, can deliver enough heat to the surface without impairing skin integrity, just stimulating regeneration and remodeling. Of course, you have to wait longer for that, but I think that this is the way it should do. I know it sounds funny to you, coming from a surgeon, you think we are much more aggressive, but it's not always like that. And what I also like is that, as you can see, the skin has shrunk already, but the aggression has not been very extreme. And so if I do another pass now, which would give me more tightening and more bulk heating in the superficial layers of the dermis, I would definitely not have a much longer downtime. As you see also, it didn't take long, thanks to the power of the machine, to complete one cheek. And now I can go and complete the other cheek quite fast. And then at the end, I will just feather the other areas. I've already warned this young guy, Bruno, our patient, that he can stop me at any minute if it becomes unbearable. But as you see, he's barely blinking. So again, we don't need to be very aggressive in these cases. That's my opinion. Just in case you like to be aggressive, this laser is powerful enough to drill to the bone. There's no problem. I just wonder whether it's needed or not. I don't know. Probably the handpiece is on the way. I'm sorry. I'm going to change direction so you can see what I'm doing. Now, if I want to increase the ablation depth, I can do it during the treatment. I've just done it. And, you know, I don't have to calibrate or anything. I've just doubled it. Bruno, vai ficar pouco mais forte agora. Se você não aguenta, me diz. Okay, I've just warned him. And you can hear probably that the noise is stronger. This ablation depth is much higher, is double, and still the treatment is bearable. Okay? And I don't know how much time we have left.
We are almost out of time. Will you show us the feathering technique you're going to use, or should we stand now? Or
so for the feathering, I just go back with a much more shallow ablation depth, lower coagulation, and I increase the density. Okay? So basically I've doubled the density, but I've diminished the others. And this is a very good treatment for the forehead. As you see, I don't have to go to standby. I can just change my parameters while working without wasting any more time.
You doubled the density.
Yes, I've doubled the density in order to grant a more uniform heating, because here, having lowered the coagulation power, I'm going to have less bulk heating in the papillary and reticular dermis. I'm not sure the heat will reach that down. So another way of doing it is increasing the density, or increasing the number of passes, so that the heat bubble beneath each little ablation can be confluent and give me a three-dimensional heating of the superficial layers of the dermis.
Okay, is there something important you think you haven't told us yet, besides the name of the wine you drank yesterday?
I'm sorry, I can't hear you very well because of the noise of the smoke evacuator. Can you
I was asking if there is something important you haven't told us yet, and you think you should.
The other thing is that I think that after all, the most important thing is to have a correlation between what happens in histology and your parameters, and not just the aggression of the skin that we see very often. So again, let's think about regenerating, promoting regeneration, and not mutilating, at least in young patients like this. And let's remember that sometimes looking for too much tightening all the time just exposes us to the risk of complications, sometimes we should also remember that we can insert some volume and we don't have to do everything with the lasers. In this way, we'll improve safety and efficacy and work by diagnosis and not just pushing every machine to the limit. Thank you for listening to me.
Thank you, Dr. Marini has to take a plane, and we'll move to Dr. Marini right now.
Bye-bye.
Thank you.